Hi there, Kathy and Jody here for the Posture 3R method. We're here to talk to you a little bit about back pain and having too much of an arch in your lower back or a lumbar lordosis. So to see what that looks like, Jody's going to turn to the side and she's going to let a bit more of a curve come into her lower back. And so you can see here it's a little bit more curvy than would be good for her to have an efficient posture. And what's going to happen is all these muscles here are going to get really tight and squished together, and the joints are going to be compressed too much, so it's going to cause a lot of back pain. What's happening in the front is her belly muscles aren't supporting her back, so they're just kind of hanging there, not doing their job. So we're going to show you a couple of different things that the Posture 3R method how the Posture 3R method would address that. Who is going to be getting this sort of posture? Pregnant women might be more prone to a little bit more curvature with that extra weight in front, or heavier set people who sit a lot, even runners. So there's a lot of tightness pulling through that back, so it's going to put you into that posture. So let's start first with the release. And Joey's going to go into a hip flexor stretch. And the beauty of this one is that you can do it anywhere. You're waiting in line somewhere, both feet pointing forward. Activate your glutes a bit so that they're aiding in the stretch as well. And you just want to feel a stretch across that front of the left thigh. And if you can raise your arms up above your shoulders if you're, not in a public place. But otherwise, you're just going to get a nice stretch to that front thigh. And that's a good release for the hip flexors, which tend to pull the back into that extra arched position. And then just lower your arms down, and we'll look at a rebuilding. So you want to take some of that curvature out of your back. So if you were against a wall, you can always use a wall. And if you have your hand and you just slide it between your low back and the wall, you can feel how you've got quite a bit of space there, especially if you have too much of a curve. So all you're going to think about doing is a tiny little bit of a pulling of the lower belly and bringing that a little bit of a pelvic tilt forward so that you can feel a little less space between your low back and the wall. And you can hold that. If you're standing without a wall, you can do the same thing, and that's how you'd put it into daily practice. You're going to start thinking about it more often, and that would be the third R. And if you want to know any more information, go check out our website at posture3rmethod.com.